So picture this. You just got off the phone with the pediatrician, your child's lab results are back, and it's positive for Giardia. Immediately the panic sets in, right? You pull out your phone, you start doom scrolling, and suddenly you're hit with these exact terrifying internet myths. Parasites, intestinal infections, chronic illness, immune damage, liver problems. I mean, it sounds like an absolute nightmare. Well, welcome to this explainer. Today, we're going to completely cut through all that noise, the panic, and frankly, the wildly exaggerated information you're finding online. We are looking directly at the grounded facts to reveal what Giardia actually is, how dangerous it really is, and most importantly, when you, as a parent, should actually worry. So take a deep breath. The reality is actually much less scary than the internet makes it seem. Okay, let's dive into this with Section 1, the microscopic protozoan myth. Let's just tackle the very first massive misconception almost everyone has when they hear the word parasite. Most of us instantly picture these long, scary worms living somewhere deep down in the large intestine, right? But Giardia, it is not a giant worm you can see. It's actually a microscopic, single-celled organism known as a protozoan. You literally cannot see it without a microscope. And crucially, it lives strictly in the small intestine, not the large intestine. Honestly, this single anatomical detail completely changes what symptoms it can actually cause in the human body. Which brings us to those wild wellness marketing myths you see plastered all over social media. You know the ones. You might have read that Giardia burrows into your liver or inflames your gallbladder or produces these mysterious parasite toxins that damage your child's organs. Yeah, these are hard no's. Giardia doesn't live in the liver. It doesn't live in the gallbladder. In fact, modern medicine confirms that bile, the very substance produced by the liver, actually kills Giardia really quickly. It is absolutely not hiding in your child's organs waiting to poison them. Moving right along to Section 2, the fecal-oral transmission route. So if it's not a giant worm destroying the liver, how do our kids actually get infected in the real world? Well, the answer is a medical term you'll hear a lot in pediatrics, the fecal-oral route. In plain English, this just means an infection happens when something contaminated directly enters the mouth. And hey, if you have a toddler, you know that they essentially act like little human Roombas, right? Just interacting with the world by putting absolutely everything in their mouths. But where exactly is this contamination coming from? Just think about high-touch areas. Dirty hands, contaminated water, daycare settings, door handles, playgrounds, bathroom surfaces, and shared toys. A lot of people mistakenly blame the family dog, but the reality is the biggest source isn't usually pets. It's other humans. It's kids touching shared surfaces and then touching their mouths. This is exactly why Giardia is so incredibly common in younger kids and in daycare environments. Now for Section 3, positive test versus active disease. Here's where we reach a pivotal turn in understanding this, a concept I like to call the asymptomatic paradox. Does a positive test actually mean your child is sick? Imagine this scenario for a second. Your child tests positive for Giardia on a lab report, but they have absolutely no stomach pain, no weight loss, no diarrhea. They're just running around, playing, and feeling completely fine. So the crucial point here is that finding Giardia is definitely not the same as diagnosing disease. Many children carry this protozoan temporarily, and their own immune system simply clears it out on its own. The human body is amazing at this. Even individuals with weakened immune systems often recover without any serious complications. Just hosting the organism doesn't automatically mean your child has an active, harmful illness. And this leads us directly to the single biggest mistake parents make. You must treat symptoms, not lab results. A positive test on a piece of paper can create massive panic. Suddenly, parents are rushing out to buy expensive herbal cleanses, intense detox programs, and complex parasite protocols. Look, most of this is completely unnecessary, and honestly, a lot of it is just pure marketing, taking advantage of your fear.
Which takes us to Section 4, evidence-based diagnosis and scams.
If we aren't supposed to rely on internet detoxes, how do we properly test for this suspect? Well, there is a very clear medical standard. Stool testing is the standard diagnostic method to actually detect the cyst or organisms. This is how you reliably identify it. On the flip side, while blood tests are sometimes ordered depending on where you are, from an evidence-based medical perspective, blood testing is highly unreliable for diagnosing an active Giardia infection. Stool testing remains the absolute gold standard, period. And please, I cannot stress this enough. Beware of fake diagnostics. If a clinic or an online health coach offers you computer diagnostics, bioresonance scans, parasite frequency testing, energy scans, or any kind of miracle device to detect Giardia,
Save your money. Seriously, these alternative testing methods have zero medical validity. They are not evidence-based, and they are literally only going to drain your wallet while increasing your anxiety.
All right, Section 5, when to worry and shriek.
So we know how to test for it properly, but when do we actually need to take medical action? It all comes down to the golden rule of Giardia treatment, the number 10. The main symptom that actually matters, the one that should really get your attention, is persistent diarrhea lasting more than 10 days. We aren't talking about one single loose stool here. We aren't talking about 2 days of an upset tummy from something they ate. 10 days of persistent diarrhea. That is your true indicator.
You should be especially alert if that persistent diarrhea is accompanied by these key warning signs: significant bloating and gas, poor weight gain, signs of malabsorption, or just prolonged ongoing digestive issues. If you see this combination, it strongly suggests an active Giardiasis infection that actually needs medical treatment. But let me reassure you right now, if your child feels well, eats normally, is growing normally, and lacks these ongoing symptoms, medication is generally entirely unnecessary.
Let's wrap things up with Section 6, prevention through proper hygiene.
Now that we know exactly when to worry, how do we reduce the risk of infection in the first place? Can you prevent Giardia completely? Realistically, no. But you can drastically lower the odds, starting with proper hand washing. And I mean proper hand washing. It's not just a quick splash of water. You must apply soap, add serious friction, and wash for at least 15 to 20 seconds. That friction is absolutely mandatory. A quick rinse simply won't dislodge microscopic cysts from the skin. And we really need to make sure we're washing at the right times. Always wash hands after using the bathroom, changing diapers, handling pets, coming inside from outdoor play, and of course, right before eating. Maintaining these exact habits, alongside drinking safe, treated water and being cautious while traveling, is incredibly effective at keeping those microscopic bugs away. Ultimately, we have to remember the big picture here. Public health matters. Things like clean municipal water systems, proper sanitation in daycares, and responsible pet waste cleanup in our communities, these reduce Giardia far more than any boutique expensive supplement ever will. Basic hygiene and societal sanitation are a true shield against this protozoan.
Which brings us to our final thought for today. Fear is incredibly contagious, especially on the internet, but knowledge is intensely protective. When it comes to parasites, the panic is often way more harmful to your family's well-being than the microscopic organism itself. So, the next time you see a test result, take a step back and ask yourself this: are you just treating a lab result on a piece of paper, or are you actually treating your child?